Hello, my name is Dr. Pasquale Cancelliere. I am the physician owner at New Hampshire Foot and Ankle Specialists, located in Londonderry, New Hampshire, and Massachusetts Foot and Ankle Specialist, located in Somerville, Massachusetts. I'm a board-certified, fellowship-trained podiatrist, and I wanted to speak with you folks for a couple minutes today about a very common condition of the feet. That condition is called metatarsalgia. Now, that is a technical term for basically pain in the ball of the foot. And it's a common condition that we treat here in the offices, and it can range from just mildly uncomfortable to very painful. And unfortunately, this condition does not get much attention in the medical community, and it's concerning to me, and it's why I'm making this video, because oftentimes, even when I see patients as a second opinion, I notice that this condition is either misdiagnosed or not diagnosed at all. Often when we examine a patient that comes with a bunion, for example, we become fixated on treating that bunion and studying that bunion. But a lot of times we notice that the bunion is caused by something deeper within the foot that translates, again, to metatarsalgia. So when we look at a normal foot, when we look at it from the instep, okay, there's a joint here called the metatarsal cuneiform joint. And again, this seems a little bit contradictory to what I've just said, because metatarsalgia, as I described it, affects the ball of the foot. But like I said, everything is connected, and so unfortunately, metatarsalgia is a downstream effect from instability in this joint. When our body goes to pivot when taking a step, we need this joint to be locked in and extremely stable to create a very rigid and efficient lever. And when we push off our foot, we concentrate 100% of the force of our foot on the big toe joint. And so what happens in patients who have instability in this joint, the metatarsal tries to deviate or rotate out to stabilize the foot. When it can no longer do that, the body starts to transfer the weight on the outside of the foot. It tries to spread the load in order to more equally and safely distribute that pressure. Unfortunately, the ball of the foot area is not really designed for that much weight bearing, and eventually those joints become very inflamed and swollen, and it can lead to stress fractures. It can lead to necrosis or infarction of the head of the metatarsal bones, and this can be, like I said, extremely painful and debilitating. Luckily, patients who are suffering from this have a lot of great options to treat this. And mainly, or for the vast majority of my patients, we have been able to treat this very effectively and alleviate their pain with something called a custom orthotic. A custom orthotic is something that's developed by molding the foot with fiberglass and taking several clinical measurements and radiographic measurements and creating a customized insole that goes in the shoe and corrects the mechanics of the foot by stabilizing the metatarsal cuneiform joint and relieving the pressure from the ball of the foot. In the more severe cases, unfortunately, surgery is sometimes needed, and often enough we do that by either fusing this joint and or making small cuts in these bones called wile osteotomies, which basically lift the head of the bone within the foot and create more padding for the foot and then force the body to refocus the pressure in the joint where it needs to. And this reestablishes that efficient lever. And whereas not every patient needs surgery, the focus of treatment is always to reestablish the normal mechanics of the foot. And this can be done in a variety of ways, like I stated. So if you or a loved one are suffering from pain in the ball of the foot, that usually gets worse as we walk on it, and this is something that's stopping you from participating in sports or just simply being physically active, we recommend you come and schedule an appointment with us. You can reach us on the web at candriafas.com, spelled CANDRIAFAS.com, or directly at the office over the phone at 603-216-2972 for our New Hampshire office, or 617-629-2806 for our Massachusetts office. We will take very, very good care of you. Thank you.